our first speaker for today.
Hi, everyone.
Hi, how are you?
I'm well, thanks. I just want to give a small disclaimer that I am online schooling a 6-year-old. So if you hear any little voices, it's to help with some math homework.
Gotcha. COVID times.
Yes.
Let's jump right into it, as maybe time might be limited. So what is your field of linguistics?
I am a speech language pathologist. That means I fall within the field of clinical linguistics.
Right. And what's your general view of this field of linguistics?
I think it is so needed, especially in our region where, outside of linguistics being not well known, the clinical, academic, and probably medical applications of it are critical at this time, especially in COVID. So the more, the better.
And are there a lot of people in your field in Trinidad?
Right now, there are 26 of us who are licensed to practice in Trinidad, but only 22 of us are based here on the islands.
Right, and that's between both Trinidad and Tobago?
Yes, there are 21 in Trinidad and 1 in Tobago.
Okay. And what other career opportunities are there in your field? So apart from you being a speech language pathologist, what else can one do having studied that?
You can, well, if you get into clinical linguistics, you can become an audiologist, a speech and hearing scientist. There are people who have gone on to be app developers, with communicative devices, hearing aids, anything where there is a clinical or medical aspect of linguistics. The field of clinical linguistics can get you into any of those professions.
Right. And what's your favorite part of your job? Like, what's the highlight of what you do for you? What got you into it?
Now, what got me into it is a very long story, and we don't have time for that.
Okay.
But my basically, let's call it TV, got me into it. And I guess the favorite part is maybe when little ones say mommy or daddy for the first time, and you can see how the parents light up and the children have no clue what they did. It's most adorable.
So you mainly work with younger children?
Right now, the field in Trinidad is mainly pediatric, but we're trying to get more adult and geriatric awareness out there. Yeah.
Right. Gotcha. And last question for you today is, what are some of the difficulties in your field?
There is not enough public appreciation. And when I say public, I mean in terms of the post. So out of the 22 of us, 21 of us are in private practice, and the public sector position is in Tobago. We do have someone who is part-time at Sando General, but she is also mainly private practice as well. And I think if we can get more public positions, then we can better serve the country.